My name's Olivia Logan. I'm a nurse practitioner at Greater Boston Urology in Falmouth. Coming to a urologist can be a really scary experience for any patient. As a nurse practitioner, I have the ability to put somebody at ease by just being a caring, gentle practitioner. One of the strengths for me in particular is sitting down with a patient and helping them understand what they may be experiencing, not just from a urologic condition, but a more holistic approach to their health care.
My name's Colleen Barry. I'm a nurse practitioner at Greater Boston Urology. One of the most important things I do with my patients is go over comprehensive medical history and really figure out what happened, why they're in my office. A lot of the main diagnoses I work with are urinary tract infections, hematuria, overactive bladder, kidney stones, urinary incontinence, and prostate issues. With those diagnoses, I would develop treatment plans and figure out the best individualized care plan for each patient.
As nurse practitioners, we are able to order any of the diagnostic testing and imaging that a patient may require, able to do certain procedures, whether it's catheterization or change a Foley catheter. And lastly, we're able to refer the patient to the urologist if they need a surgical intervention or further evaluation.
So education is definitely a cornerstone of my role as a nurse practitioner. I want the patient to be involved in their care and know what's going on in their body. We want to make sure their treatment is effective and that they're seeing improvements in their symptoms. So I will often manage side effects, address concerns, answer any questions a patient has about a diagnosis. A lot of the education I give to my patients is anatomy and physiology, along with diet and exercise and self-care techniques to help the patient have the best outcomes and have great urologic health.
I want to empower the patient to make the best informed decisions about their health care and their urologic conditions. So if I can better help them understand what's going on from a urologic perspective, other health conditions that may be impacting their urologic health, then I feel like I've done my job well. We're able to have a little bit more time with our patients, get to know them, follow up with them. And for me in particular, I keep a close eye on my patients. I tend to be the mother hen and call them, make sure that they're getting the follow-up that they need.
Luckily, we work hand in hand with the urologist, so I can ask them any questions that I do have, but I can also get a patient ready and get them completely worked up to see the urologist, particularly if they need like a surgical intervention or something requiring being in the OR.
Sometimes we do need to refer patients to other specialties, whether it be a general surgeon. We'll often have to send patients over to the hospital for diagnostic testing or imaging. Sometimes our patients require emergent visits to the emergency room. So it is important that part of our role as a nurse practitioner here is being able to collaborate with other healthcare professionals or other healthcare institutions. Greater Boston Urology services a large population of elderly patients in the Falmouth area. We're quite accessible near the hospital. Patients are able to get here from the islands. You can pick up the phone and speak to an administrative assistant and get an appointment in a timely manner. We also work really hard to make sure that if somebody's having an urgent concern or urgent urologic concern, that we're able to get them in for an acute or urgent visit.
Individualized care is very important to each patient. Every single person is different with a different past medical history, and that really does determine their plan of care and how we would move forward. At Greater Boston Urology, I definitely think we treat a patient holistically with individualized care, which is what the patient deserves.